The storm begins. Sometimes, the body's greatest protector becomes its most dangerous enemy. HLH, Hemophagocytic Lymphohistiocytosis, is not just another medical condition. It is a runaway cytokine storm, a silent fire inside the immune system, rapidly destroying blood cells, overwhelming organs, and pushing patients toward critical illness within days. If missed, HLH can be fatal. But when recognized early and treated aggressively, lives can be saved. This is a condition every clinician must understand, because when HLH strikes, every hour matters. Pathophysiology. When the immune system breaks, deep within the immune system, a critical switch fails. The very cells designed to keep us safe, cytotoxic T cells and natural killer cells, can no longer control the battle. They cannot shut down the alarm, and so the immune system is left firing uncontrollably. Macrophages, now unrestrained, awaken into a state of hyperactivity. They begin releasing waves of powerful cytokines, IL-1, IL-6, TNF-alpha, interferon gamma, a toxic storm that spreads like wildfire. This is not normal inflammation. This is immune chaos. Blood cells are destroyed. Organs swell with inflammation. The brain, the liver, the lungs, all become victims of the storm. HLH is the moment when the immune system forgets its purpose and turns its strength against the very body it was meant to protect. Types of HLH. Two paths to the storm. There are two faces of HLH, both dangerous, both capable of overwhelming the body. The first is primary HLH, born from within, a flaw in the genes that control the immune system, a hidden weakness passed silently through generations. Children who seem healthy one day can collapse into a cytokine storm the next. Only a new immune system, a bone marrow transplant, offers a chance at survival. The second is secondary HLH, triggered by the outside world. A viral invader like EBV or dengue, a lurking cancer such as lymphoma, or the body's own autoimmune rage, can ignite a catastrophic chain reaction. Young or old, anyone can be pulled into the storm, if the trigger is strong enough. Two origins, one destination, uncontrolled immune destruction. Clinical features, signs the storm has arrived. It often begins with something deceptively simple, a fever. But this fever does not break. It burns relentlessly, a warning of the storm building beneath the surface. The liver and spleen swell, pushed by invading immune cells. The blood starts to disappear. Red cells, white cells, platelets, consumed by macrophages as if the body is devouring itself. Jaundice stains the skin. A rash may appear, and the brain may falter, confusion, irritability, seizures. Signs that the cytokine storm has reached the nervous system. Meanwhile, the body's ability to clot collapses. Bleeding begins. Evidence that the immune fire is burning through the bloodstream itself. Left unchecked, this cascade leads to one final outcome: multi-organ failure. HLH does not wait. Recognizing these signs early is the only chance to stop the storm. Diagnostic criteria. Clues in the chaos. When HLH is suspected, every second counts. Diagnosis becomes a race against time. Because the disease moves faster than the tests that reveal it, the body gives the first clues. A fever that refuses to break. A spleen that grows heavier and larger. The blood tells its own story. Cell lines collapsing. Red cells, white cells, platelets falling together. Labs paint a clearer picture. Triglycerides rising. Fibrinogen falling. Markers of macrophage overactivation. Inside the bone marrow, a chilling sight: hemophagocytosis. Macrophages devouring blood cells. One number stands above all. Ferritin not elevated, but explosive. 10,000. 20,000. A signal impossible to ignore. NK cell failure. SCD25 sky high. Proof of immune runaway. When these clues align, the diagnosis is clear. The storm is real, and treatment must begin immediately. Investigations. Hunting for the trigger. When HLH is suspected, the investigation becomes a hunt. A search for clues hidden in blood, marrow, and the immune system. The CBC shows a silent collapse of blood cells. Ferritin skyrockets into the thousands and beyond. Liver enzymes rise. Clotting factors fall. The storm spreading across organs. Triglycerides climb. Fibrinogen drops. LDH and D-dimer reveal widespread destruction. The bone marrow may show hemophagocytosis, an immune system devouring itself. Meanwhile, viral tests search for hidden enemies, EBV, CMV, HIV. Autoimmune markers look for deeper conflict. Each clue brings us closer to the truth, and closer to the fight that must begin. Treatment. Fighting the storm. When HLH is identified, there is no time to hesitate. Treatment must begin immediately, because the disease accelerates faster than almost anything in medicine. The first battle is stabilization. Shock, bleeding, failing organs. But the real enemy is immune overactivation. To stop it, we turn to the HLH protocols. High-dose dexamethasone to calm the immune fire. Etoposide to silence the overactivated cells. Cyclosporin to halt the runaway response. Then the search begins for the spark that lit the fire. EBV, treated with rituximab. Lymphoma, treated with chemotherapy. Autoimmune triggers, quieted with anakinra. Some require IVIG, others plasma exchange. And emerging therapies like JAK inhibitors join the fight. But for those born with the storm in their genes, only one cure exists: a bone marrow transplant, a complete reset of the immune system. HLH treatment is a race, a fight to pull a patient back from the edge, before the storm consumes everything. Prognosis. Time is everything. HLH is a disease where time determines fate. Every hour of delay strengthens the storm and weakens the chances of survival. With early treatment, there is hope. Inflammation falls, organs recover, and many patients with secondary HLH survive once the trigger is removed. But late recognition can be devastating. Neurological injury, liver failure, uncontrolled bleeding, and irreversible organ collapse. For children with primary HLH, survival often depends on early bone marrow transplantation. The truth is simple. The earlier HLH is recognized, the better the outcome. Final summary: recognize. Act. Save a life. HLH is a fierce, unforgiving storm of immune activation, but its signs are clear: persistent fever, cytopenias, hepatosplenomegaly, and ferritin levels that soar beyond imagination. When these clues appear, HLH must be suspected, and treatment must begin immediately. Steroids, etoposide, cyclosporin, treating the trigger, supporting the organs, and when necessary, replacing the immune system itself. The message is simple, urgent, unforgettable. Recognize HLH early. Act quickly, and you can save a life.